Hello, everyone. This is Bob from Motion Physical Therapy. Just want to take a minute to talk to you about treatment options for two things, for knee arthritis and for degenerative meniscus tears of the knee. Recently, there's been over the last few years, there's been a lot of research coming out on how to manage these appropriately in the aging population, people 40 and over. One of the things we find is that as we get older, degenerative meniscus tears, a little bit of arthritis in the knee is very common, even in people that don't have symptoms. And we're also finding that for a lot of these conditions in which surgery is done, when they compare the people that have had surgery who didn't have surgery, that went through a good rehab program, there's no difference in the outcomes and how well people do afterwards when you've had a surgery versus when you've had appropriate care without surgery or injections. So one of the key things we're finding is that exercise is probably the best thing you can do as a first line of treatment for knee arthritis and for knee degenerative meniscus tears. Now, you may be thinking, first of all, well, my knee hurts. I can't exercise because it hurts. I've tried, and every time I do it, it hurts a lot, and it's just something that I can't do. Well, I'm going to tell you that what you need to do is, number one, find somebody to help you out, okay? Because what I find in my clinic is that no matter how bad somebody's symptoms are, or the pain or the swelling, we're usually able to find something that they're able to start doing to begin with that allows them to progress forward and eventually be able to do more. Now, in order to do this, what we have to realize is that there's not a one-size-fits-all exercise program for every knee pain patient. So through an assessment, through talking with you, to finding out what's going on with your knee, as well as finding out what your goals are, the exercise program needs to be tailored specifically to how you present and what you want to be able to accomplish. And number two, when pain is a big factor, there's a lot of things that can be done from a hands-on perspective to help decrease the pain, improve the mobility of the knee, and allow you to move better with less pain. So some treatment first on the knee with the idea that then will allow you to move with less pain so that you can start to get into an exercise program. The other key component, other than decreasing the pain with some hands-on treatment, and finding an exercise that you can do specific to your needs, is that you need to understand what the expectations are. And by this I mean that as you start your program, some pain or some discomfort is going to happen, and you have to know what's okay or what's acceptable when you're exercising. First of all, like how much pain is okay, how much pain are you okay with experiencing during the exercise. But then secondly, you need to understand, okay, how do I monitor and know if what I did was too much, too little, or just the right amount? And with individual guided exercise program, I would help you do that, or your healthcare practitioner should be helping you understand what's expected, what's okay, and then how to progress or regress your exercise program as needed based on how you feel during and how you feel afterwards. So when done appropriately and when done correctly with a program that's tailored to your needs, exercise can be one of the best first-line treatments for knee arthritis and for knee degenerative meniscus tears. And in fact, research has shown that long-term exercise may be the best solution for most of us. For most people with knee pain related to arthritis or degenerative meniscus tears. So if you're curious about how this might help you, or if it will at all, feel free to reach out to me at my office. You can email me or call at 920-857-1622, and I'd be happy to talk with you. But before taking that step to a surgery that may or may not help, surgery which I'm finding as I talk to more people, they're not, at times, not much better than they were before, and you'd hate to be in that situation where you've had a surgery or you've had your knee replaced and you can't function much better now than what you could before this. You want to go ahead and try to do everything possible from a conservative management standpoint to help your symptoms before taking the next step to surgery or even injections, or worse yet, even taking painkillers all the time to help you manage. So again, reach out. I'd be more than happy to talk with you, but there is a way that you can manage your symptoms from knee pain caused by arthritis or degenerative meniscus tears without surgery, injections, or taking pain pills. All right, thank you for listening, and I hope to hear from you soon.